Welcome everybody, Chris Quinones here from Rasayana, and today I am joined by Dr. Gregory Randolph from the Mass Eye and Ear Infirmary in Boston, Massachusetts, who is the Chief of Thyroid and Parathyroid Endocrine Surgery, as well as Otolaryngology Professor at Harvard Medical School. And I've known Dr. Randolph for many years now as one of his research assistants and office assistants when I first started in my path of a medical career. And I'm so happy to have him join us today because in a lot of the work that I do as an Ayurvedic health counselor, I'm finding an alarming rise in the amount of thyroiditis and thyroid issues that are coming in on clients' health history forms. And so I wanted to pick Dr. Randolph's brain today about some of his process in diagnosing thyroid disorders, what kinds of considerations need to be made, and help incentivize a more collaborative effort between complementary practitioners and allopathic ones. That this is not an either or that you need to choose. This is about picking the best parts from both systems or any system. Today, we're talking about Ayurveda because that's my professional training. But I think generally the subject around integrative approaches to our well-being involve more conversation with our doctors about what we're doing in between those appointments and how we can work together as a team to meet our goals. So welcome, Dr. Randolph. Thank you for taking the time to join us today. Really
Thank you, Chris, and thank you, everybody in the classroom and Chris's learning community there. And it's a very good question, and I think I don't know that I have a perfect answer for why we see so much Graves and Hashimoto's thyroiditis now. They are both, as you know, autoimmune diseases where the body has made a mistake. The immune system that is meant to identify foreign invaders, viruses, and bacteria is for some and injure those and rid the body of them is for some reason focusing on normal antigens within the thyroid gland. We don't really know why that happens. It's really a form of immune dysregulation. And so, and you know, in that way, we're thinking even more and more that malignancy, cancer is perhaps on that spectrum, because one of the things the immune system also does, in addition to viruses and bacteria, is cells that are altered through a mutational process that are becoming malignant are also fairly efficiently, for most of us, cleared from the body. And so we all are developing like little precancers that we think are very rapidly and innumerable circumstances all through the day are cleared from the system. So, you know, the immune system, it's easy to say it's not doing a good job. It's doing a fantastic job to keep us all free of viruses, free of the bacteria, and free of the multiple cancers that would be developed just from natural cell division. But, you know, there are these errors that occur. And so in Hashimoto's thyroiditis, the antibody is targeted towards some of the integral portions of the normal thyroid cell, and with time causes depressed thyroid function. Interestingly, in Graves' disease, it's an antibody that is found its way to the TSH receptor in the thyroid gland. And so although an antibody that is fighting and attacking the thyroid, it is the key that goes into the lock of the normal stimulatory hormone, perversely enough. And so that antibody mimics hormonal stimulation to the gland, which is really, I mean, it's amazingly perverse that an antibody would do that, but nonetheless, it turns the thyroid on inordinately and leads to hyperthyroidism. So the other thing I would just say is that if you think it's simple, it really isn't. And there is Hashimoto's thyroiditis with low thyroid levels, and there are patients with Graves' disease with excess thyroid function. they are both autoimmune disease, but there's also something called Hashimotoxicosis, which is where these two separate entities blend to some degree, and patients at one time will have a clinical picture that is primarily Graves' disease from hyperstimulation of the gland with hyperthyroidism, and then with time, Hashimoto's thyroiditis. So, we are clumsy in how we define these
Mm.
diseases by what are the main symptoms that hang together, and then we'll put a label on it and call it Hashimoto's or Graves' disease, when in fact it's the immune system in innumerable different subtle ways is becoming dysregulated. And only when it comes in a clear-cut path that's easy for us to understand can we call it Graves or Hashimoto's. But the disease process is much more textured and subtle and less clear
Yeah.
than when these diseases blossom in ways that we can recognize them because there's a paragraph in a medical text that describes it.
That's right. And that really speaks to a lot of this subclinical thyroiditis, right? That there are symptoms that are growing before we get to a point of symptoms manifesting where we notice. And by the time we get to maybe your office, the pathology progress has already gone down many stages, and it's nebulous because there are so many factors that contribute to autoimmune compromise that there is no one element. It's really kind of the combination of all of them. So oftentimes the symptoms of these conditions are confused or diagnosed as other conditions. And so it's not so easy to figure out, especially if you've got.
It's really not easy to figure out. And that is, even something like diabetes, when you see flagrant advanced diabetes, it's very clear. But in the early stages, it is really not at all clear.
Right.
And the same is true for Graves and Hashimoto's, that, to be a little tired,
Mhm.
whether that is evolving into frank hypothyroidism or just you had some degraded sleep recently. I mean, these are all, like, all pathologic states have analogy in our normal moods every day,
Right.
uh, and
Right.
and so, when it gets to the point where someone thinks it's significant, well, it depends. Some people, you could hit them over the head with a brick and they'd be like, I feel okay now. Other people, you could look at them cross-eyed and they'd be like, boy, I really feel terrible. Everyone's individual sensitivities to a given amount of this hormone or that hormone is very variable. So it's hard to make these hard and fast disease definitions, knowing the gradations of their development. And it's hard to define sets of symptoms with human variability that we know exist in every individual.
So that being said, what are your kind of go-to tests? When a new client comes into your office, what do you start with?
Yeah. So when I want to, I mean, many of the diagnoses that I deal with, goiter, which is a benign enlargement of the thyroid gland through a benign proliferative growth process that is not malignant, and also thyroid cancer, which is the other main area of my work. Most of the times, the thyroid levels are actually perfectly normal, which also goes into this kind of idea that, well, if there's something structurally wrong, there must be something functionally wrong. And that sounds very reasonable. It just turns out to not be the case. And the way I look at that is this incredible redundance of safety that the body generally provides us, with. And so you can have multiple areas of the thyroid gland that are now occupied with either benign goiter or cancer, and yet if you have about 50% or so of the thyroid gland that's still normal, it's perfectly capable of keeping your levels normal.
Is it
So
really
what
even at
what we
50%?
what we know, we can take out about half of the thyroid, and generally in most patients, about 80%, the levels are still normal. So there's a lot of redundance in the thyroid. But basically, the main test is actually when I am trying to determine someone's thyroid status, you can think of it in two ways. You could just measure the T3 and T4, which are the main hormonal products of the thyroid gland. But what we really do is we really ask the pituitary what it thinks of the thyroid levels, because the thyroid gland, as beautiful as it is under complete control of our master gland, which is the pituitary. That in turn is a nerve ending, basically. It's part of your brain. So that whole idea of, well, there's neurologic and stress function, and that's separate from your hormonal system, it is really clearly not the case. The pituitary is a portion of your brain that is in turn regulating your endocrine organs. So, you don't have to look hard to see a mental status, stress, central nervous system connection to the glandular system. It's very clear cut. There's a nerve that's controlling all most endocrine function in the body. So what we do is we can measure T3 and T4, and sometimes we do, but the main test we measure is TSH, which is thyroid stimulating hormone, which is the hormone in the pituitary, which is secreted by the pituitary to maintain trophic ongoing support for the thyroid gland. I describe it to my patients, it's like the foot on the accelerator. In other words, for the car to move forward, for the body to function, you need a certain amount of TSH as a foot on the accelerator to stimulate the thyroid gland to secrete normal amounts of T3 and T4, which then are the hormones that go out and mediate all of the thyroid hormone effects on the body, which are basically, in a rudimentary way, they control metabolism overall, the speed of the engine. So if you have too much thyroid hormone, then you'll sweat, you'll lose weight, you'll get anxious, your heart will race, too much foot on the accelerator. And if you don't have enough thyroid hormone, then the car will slowly roll to a stop, and you'll gain weight, and you'll be obtunded in your thinking. Women's menstrual cycles will become abnormal, and you will slow, your skin and hair will thicken. And so all of those throughout the whole body, those processes just glide to a halt. And ultimately, if there's profound hypothyroidism, you can fade into a coma. You need, for CNS functioning, you need normal thyroid stimulation. But again, this is all controlled by a nerve that is a neural structure of the pituitary. So we check a TSH. But as Chris, you and I were talking about that before, that I think that it is clearly, the TSH is clearly a tremendously important preliminary data point to determine someone's thyroid status. But for example, when we have someone on thyroid hormone, say I've taken their gland out because of a cancer, or say they've needed it because they have end-stage Hashimoto's thyroiditis and they need to be put on thyroid hormone. So then that is generally a well worked out system. You can take a human, take out their thyroid, give them thyroid hormone, and they can continue to thrive. But it's a clunky way of doing it. It's successful, but it's a very different situation than having a normal thyroid in place. Right. So it is the hormone that you give, but it is T4, not T3 that you're giving. So the exact complexion of that balance in the normal person, that is someone who doesn't have any thyroid problem, is a little different than someone who is receiving a medicine by pill. Also, in the person who is just having spontaneous normal thyroid function, their thyroid gland, their pituitary and thyroid gland, is all day long creating pulses of this hormone going out. So if you graph their hormone during the day, there would be normal amounts all through the day. And if you don't have a thyroid gland and you're taking it by a pill, you have sufficient thyroid hormone on board overall, but you receive that in a spike that occurs right after you take the pill. And you don't have nearly as much as you would normally have before you take that pill. And you have more than you would normally have right after you take the pill. And then 12 hours later after the pill, you have less. If you average out the area under the curve, it's the same, but the pattern, what your body is seeing in terms of the landscape of thyroid hormone levels is really quite different. So I would say, in general, we do well with that, but
Mhm.
it isn't a normal situation. And so I usually tell people that when a doctor is regulating, for example, thyroid hormone levels, it's two things that need to be satisfied in order for the care to be optimal. The first is the numbers, that is, the hormone levels of TSH that are assessed in the lab, they need to be in the normal range. And the second piece of it is, and also the patient needs to be happy. Generally, those two things occur all at once, but not always. There can be patients who are relatively insensitive and their levels may be off, and yet they feel okay. And sometimes those patients need to have their doses altered, even though they may feel okay, because for whatever reason, they may not be sensitive to some of the symptoms. Typically, for example, elderly patients are less sensitive and less demonstrative of hypo and hyperthyroid symptoms for whatever reason, geriatric changes in their body or whatever. They may not give you the same symptomatic breakdown when they're hyper or hypothyroid than, say, Chris, you would at your age. So you have to understand that when you say, I'm asking a patient about a symptom, well, wait a minute, who is that you're talking to? How do they understand your question? How sensitive are they to a given symptom that someone of another age may be more or less sensitive to? Um, and then there are cases where also the levels are perfectly normal, and yet patients are not feeling quite right. And then I think, well, although that's not real common, it certainly does happen. And if you look at the profile of thyroid hormone with a pill versus normal thyroid hormone, they're quite different. And so that needs to be a conversation with your healthcare providers, alternative providers, Western medicine providers, the community that's taking care of the patient all need to engage in a conversation. And that's just one thing, Chris. I don't know if you want to talk about it now, but as a surgeon, I often will need to speak with, say, cardiologists with patients who are on anticoagulation because they're giving anticoagulation so the patient doesn't have a stroke. But I'm doing thyroid cancer surgery so the patient doesn't die of a cancer. So I can't have anticoagulation and they must have anticoagulation. So it's a kind of a, we're really in in opposing forces. I mean, it's all for the good of the patient, but so very often we need to have hard conversations. Well, I want to do this for the patient. No, I want to do this for the patient. So I need to speak to that cardiologist and share with them my concerns and understand their concerns. And I think, like, if someone is being treated by Chris or another professional, uh, that physician needs to be completely open with understanding the importance of that alternate care that they have and sharing that information. I think it's really important to
Absolutely.
share, to, like, if someone is seeing Chris and then coming to see me for thyroid surgery, they must share the information about Chris. In other words, Chris isn't over there and I'm over there. We're both here for the patient. And we need to be acknowledging each other, just like I'm calling the cardiologist and sharing information with the cardiologist to get optimal care to the patient. And so any physician that is not willing, like, if I told my patient, I'm not going to call your cardiologist, just tell them stop the anticoagulation, they should walk out of my office and go and find another surgeon, you know? And the same way, if Chris said, well, I'm telling you this, but I don't want you to tell Dr. Randolph about it, then you should leave Chris's office. And if I said to you, look, I don't want to hear what Chris told you, I'm your surgeon, just do what I say, you should leave my office. In other words, it's all about you, and all of the people that you have on your team need to be coordinated, to be collaborative, because your best care is going to be through that collaborative pathway.
Yeah, and an important aspect is the responsibility as clinicians to keep our clients and patients safe. And while there are natural remedies out there, nutraceuticals, if you will, and herbs and lots of botanical formulas out there, there are interactions with prescribed medications that do occur. And so having a clear understanding of what your patient is taking, combined with,
Absolutely.
is absolutely critical. And in Ayurvedic medicine, there's less of a database, if you will, of those documented interactions as compared to Chinese medicine, traditional Chinese medicine, for example, which just seems to have a much better documentation of some of those risks of complications as compared to Ayurveda. I'm not sure why that is. I suspect it's because Ayurveda is still relatively new to the Western part of the world. Um, but broadly, as Ayurvedic health counselors, our scope of practice, we're trained not to even mention herbs or botanicals until many months down the road, because getting to the source of that nervous system nourishment in stress management comes in our lifestyles. It comes in how we prioritize our sleep, how we are able to be resilient to stress, and that's really at the core of what Ayurvedic health counselors prioritize is, are you sleeping well? Are you digesting well? Not just about what you eat, but how you're digesting is more important to us. And
Yeah, I
look,
think this is a burden, though this is, I should say, a responsibility of both we as healthcare providers, but also the patient. That, this is about opening up the window and letting the sun shine in. In other words, who you see, how you interact with them, the medicines or supplements or other treatments that you get. This has to be common knowledge. And one shouldn't be like, well, I'm going to keep this over here and compartmentalize from that. That's a recipe for disaster. But so the patient, I think, has that burden to make sure that we understand everyone who's on the playing field. And then we also have to be permissive, right? Because if we say, oh, you're not seeing that one, if Chris says, oh, you shouldn't see Dr. Randolph, you should see a different type of physician, if we are negative and not collaborative with each other, then we destroy those relationships that we could otherwise build. So we have to all be polite, collaborative, respectful, and be there equally for the patient.
yeah, be inquisitive, willing to learn ourselves as practitioners, that we're not the repository of all knowledge.
Well, my openness to
Yeah.
you, Chris, and to your medical philosophies and treatments is because I've been doing this long enough to know that Western medicine does not have all the answers. There have been things that have happened in my practice, surgically and otherwise, that I am not able to understand. And believe me, I have studied long and hard. And it is not because I'm ignorant that I can't understand these things. There are things we do not know. And so if I knew everything, I would be much less tolerant of other systems, But I've been doing this a long time and I'm smart and I've been paying attention every day and I still don't understand everything. So that means there are other approaches, other ideas that I should acknowledge and welcome because I don't have all the answers. Western medicine doesn't have all the answers.
Yeah.
I think this thing about, stress and immune system, it really isn't in any way violating any Western medicine principle. I mean, we've just talked about how it's a nerve structure that regulates all of the hormones in your body, basically. Um, so, and we're also familiar with, our ability to manage. Like at any one point in time, we may be having anywhere from 0 to, I don't know, 10 different medical issues to varying degrees. You have atrial fibrillation and you have a thyroid nodule and you have a nervous stomach and reflux. And, some of them may be more severe, some of them may be less severe. But it's such a common and intuitive experience that people have that in times of stress, all of these things become worse. I mean, I've just, as a practitioner over 30 years, there's nothing more true than that. Even problems as mundane as acid reflux
Mhm.
are tremendously more active in times of stress. I found also arthritis is another symptom like reflux, sometimes absolutely miserable, and you're taking all kinds of medicines and you're refluxing like crazy and your joints are hurting and painful. And then other times you may not be taking any medicines and you wake up in the morning and you feel like, boy, I feel great. I'm not even reaching for Tylenol. There are both acid reflux and arthritis are examples of like they're always there in the background, and sometimes they flare and sometimes they don't. And it's
Yeah.
everyone's experience. I think, Chris, I'd be interested to hear your thoughts in that it's intuitive to understand that patients in times of stress have those baseline problems start to well up from the basement and become more apparent.
Yeah, yeah, absolutely. I think it's old news that stress is the cause of disease, right? And it's a matter, not just stress, obviously, but stress is a big one. And when someone is diagnosed with an autoimmune disorder, they're more likely to develop a second or third one in their lifetime. And now it's becoming more complicated with autoimmune disorders because the symptoms are becoming broader and the diagnoses and names of them are growing in number. So we're having over 100 defined autoimmune diseases right now, where just a decade ago we didn't have that many. So this is where complementary medicine can really support our common patient and wherever they are in that stage of pathology. Ideally, the complementary practitioner is going to want to catch these imbalances before they become pathological and produce symptoms, that we want to get to it from the source. But that requires a bit of skill set that culturally we haven't learned. We haven't really learned how to pay attention to the signals our bodies are whispering until a brick is dropped on our head and we don't understand why we can't get pregnant or we can't get out of bed and perform daily activities without exhaustion. And that's where I think yoga has been really helpful, and a lot of these contemplative practices from different parts of the world to help connect that mind and body, to help give some nourishing tools and skill sets for the nervous system in the end, um, is really where it's at, and where a bulk of the work is done as an Ayurvedic health counselor, of looking very closely at the person's sleep habits and night hygiene, because that is such a huge component of the body's ability to repair itself. That's where all the damage to our cells is being repaired, and we're detoxing the liver and gallbladder while we sleep. And so sleep and the deprivation of it is, I believe, a huge piece of the puzzle around autoimmune disorder, as is our inability to maintain healthy healthy gut biome. And that's a bigger conversation in the wellness world of, well, then we have to look at our agriculture, we have to look at our pollution in our daily environment of the air that we're breathing, and we have to look at the mineral deficiency in our soil, and that our food is nutrient deficient. Even if you're eating organic fresh food farm to table, that carrot does not have the same nutrient density that that carrot had even just 10 years ago. We have a lot more genetically modified food that just hasn't been around long enough for us to really know the effects on the body of that. So, so these components, along with liver health, I believe, are really the big benchmarks. Are we sleeping? Are we digesting? And how is the health of our liver right now? Uh, those are where I see the biggest components in autoimmune disease, and where a lot of the health counselors focus on is the three pillars of Ayurvedic medicine are, we say, food, sleep, and sex Are you nourishing yourself? Are you resting yourself? And how are you expending your life force energy? What decisions are you making in life? And this is where a lot of the philosophy of yoga and Ayurveda and the language is very helpful to people around making choices that are beneficial. And understanding what is beneficial to one will be different from another, much like you were saying, depending on the stage of life that person is in, what other factors are involved. Certainly, I think that there are different risk factors for people of different ethnicities that is often overlooked and not accommodated in allopathy. That a lot of the Western data seems to be based a lot on Caucasians versus other races that might be more susceptible to certain diseases. That's kind of the pieces of the puzzle that I see a lot of. And I don't have the answers for all these things, of course, but when I meet with a client, I want to know what they're doing in their daily lives in terms of how do they spend their energy, how do they prioritize their rest, and are they eliminating every day? Are the bowels functioning? And we know that we've got this brain gut connection. Now people are getting hip to the vagus nerve and its impact on the body. And if, we need to shift the mindset of you are what you eat more to you are what you digest. Because if you cannot metabolize what you're putting in, it's not of any real use. If anything, it's going to create this accumulated toxicity of undigestible material or substance in the body. In Ayurveda, we call that ama. It's that which cannot be digested. And Sanskrit is the language of Ayurveda and yoga. And ama is not only gross in the tissues in terms of accumulated plaque in arteries or gunk up in our guts, but also in the mind, that there's mental ama. There are experiences in life that maybe we haven't fully digested. And that has an impact on the mind and our decision making. And so that's why Ayurveda encompasses not just body and mind, but also spirit and soul, getting into what it is that our natural tendencies and inclinations might be. And how do we use that knowledge of our individuality to power our healing, whatever path that might look like. And that's what I think is an important consideration, looking at the big picture, being able to zoom out and educate our patients and clients on how to inhabit their bodies again. How to, we are overscheduled, we're stretched out thin, we're being hurtled through time and space at a pace that we just are not as organisms designed to assimilate the amount of data that we take in the modern world right now. And a big part of care in Ayurvedic medicine is caring for the sense organs, because the sense organs are our portals to the soul, to consciousness. And every cell in Ayurveda has consciousness in it, that the ability for the body to heal itself and correct these pathologies exists within ourselves. It's just buried under conditioning, under thought patterns and behaviors culturally. And then here, particularly in America, our agriculture is so corrupt that it's hard to really nourish yourself. And the act of planting a garden and providing your own food is a radical act, and really being able to, as you say, the patient take, part of the ownership in the process. That's what integrative medicine is. It's the intersection of traditional medicine, allopathic medicine, with complementary medicine, with self-care. So that's the third link, of having patients understand what it is they truly need to nourish themselves and get that repair. I believe, and I see it in my clients, which is running ourselves into the ground, not prioritizing enough rest, trying to take on and digest too much, too many impressions, the types of entertainment that we watch, the gossip we might listen to, the substances we put on our skin. These are practices in Ayurveda that we spend a lot of time with, of taking care of the eyes, taking care of the skin, taking care of the gut, taking care of the ears, because that is what allows us to see and experience life more clearly. Because if the sense organs are not healthy and the tissues of the sense organs are not functioning properly, then our perception of reality is altered. And as a result, we're not going to make as beneficial decisions. So, a lot of the daily recommendations a health counselor in Ayurveda would give to a client are around daily care for the sense organs, scheduling periods of silence, for example, so that the nervous system can actually digest. It has the space and time to digest the impressions that it's taking in. That's one example. Doing a daily oil massage on the skin is a wonderful support to the lymphatic system that we recommend in Ayurveda, as well as the practice of just touching ourselves in a nurturing, caring way and embodying ourselves just through touch itself, which is why massage and body work is so impactful for people beyond the circulatory effects that it produces. I think that seasonal cleansing is very common in a lot of complementary modalities that is not yet valued in our Western culture. Having a kind of a regular cyclical period of time where we are flushing out our guts and cleansing the liver and giving it a break basically from modern living and all the things that we have to assimilate is a lot. And it's a lot more than just one generation ago, because how we live is so different. And now we're having 5G networks and so much more EMF, radiation. And I know that that is a component to thyroid health and risk, as well as decreasing liver function. Though it's the gut, the liver, and EMF radiation are like the three big pieces that seem in my research so far to be a pretty big component on autoimmune disease in general, not just thyroid health. Yeah. Quality of what we're taking in. Is it nourishing to the body and the soul and the mind? It's either anabolic or catabolic. So depending on what symptoms are presenting, sometimes you might need that catabolic energy to break down lethargy and stagnant sloth and torpor. But if you need anabolic energy, what more of us need, because we're hurtling through time with our schedules packed and not sleeping well and not eating well. And these are the practices and lifestyles that complementary therapists can help a lot with. And then once those are in place, once we've got a solid sleep routine and hygiene, we've got a regular elimination within an hour of rising in the morning, then we'll look at botanical supplements, but not until then. That's something that I find commonly clients will come in my office very eager for a wellness holistic approach. And the first thing they want to know is what herb they should be taking. And it's premature. Ayurveda would say, well, if you're not digesting well, you're not going to digest the herb well. Your body can't access those ingredients, those bioactive ingredients, if you can't break it down and digest well. So Ayurveda is beautiful because it's so simple in many ways, getting down to the basics of how do we nourish ourselves. So I do want to respect your time, and maybe we can continue this conversation another time, because I think there's a lot here in terms of what do we do when a patient gets to the point where surgical intervention is necessary, and what are the benchmarks for that? and what do we do to help them heal
Yeah, I'd
after?
be very interested in having a conversation about how you and your work could optimize patients as they move to surgery. That's a big ticket item for me. So I just want to thank you, Chris, for your time and your thought, and your professional work, and also to your students to say hi. And yeah, I guess you all will speak with Chris and see if there's other conversations we can have. I'd be very happy to be here.
Thank you so much, Dr. Randolph. Namaste.
Okay,
Be
thank
well.
you.
Bye-bye.
Thank you. All right, very good. Chris,